Let's move on to an email we received from Karen in Salem, Oregon, who has a question about hair loss. She writes, I always hear about men losing their hair and getting hair transplants, but is it a common procedure for women too? Join us now is Dr. Mark Dower, a top hair restoration surgeon, and his patient, Lynn.
Welcome.
Thank you.
So obviously the answer is yes. Because,
of course it is.
Because women are losing their hair, not always for the same reasons that men are, but they lose their hair. In her case, she had a facelift where they removed hair, so her sideburns moved. She was missing part of her scalp. Well, and that's one of the great indications to put hair back.
Absolutely. And in Lynn's case, there was a small surgical scar where the incision was made actually in front of the hairline. So it not only caused hair loss in that area, but you could see that scar there as well.
That is a significant amount of hair loss for someone.
I mean, you really were missing that the sideburn was gone.
Gone, totally.
Can I take a look?
Yep.
And so you use microfollicular units, right? Each individual hair you probably took from the back, right?
Exactly.
And put each one in individually.
And it happens not only in facelift procedures, but in any procedure or injury that causes a scar, in many cases causes the follicles that are present in that area to die. And those follicles don't come back.
So if you're someone at home and you have issues with hair loss, whatever it may be, what other conditions would this work for?
Well, there's a number of reasons why women will approach hair restoration surgery. Obviously, Lynn's case, post-surgical hair loss is a very common one. Another one are women that have high hairlines, wish to have their hairline lowered, hairline advancement. That's another common reason. Another thing is traction alopecia. That is where constant pressure on the hair causes the hair to fall out, like in cornrows or in braiding. But the most common reason why women seek out hair restoration surgery is in female pattern hair loss. It often occurs after a big hormonal change, which can be around pregnancy or menopause. And unlike male hair loss, which manifests as thinning in the anterior hairline, in the front hairline, or in the back of the crown, usually in female pattern hair loss, the hairline itself is actually preserved, but there's thinning over the entire top of the scalp. Now, in women that have that type of hair loss, if the back of the hair is preserved, then we can very often transplant the hair from the back to the areas of thinning.